Good afternoon. I'm Dr. Bonnie Henry, Provincial Health Officer for British Columbia, and this is our COVID-19 update for BC for October 22nd. I want to start by acknowledging that we are on the traditional territories of the Lekwungen-speaking people, currently the Songhees and Esquimalt First Nations, and we are, as always, very grateful to be doing our work on these lands today. So today I want to talk to an update from our last 24 hours, as we do, but also to talk about some of the areas of concern that we have in our communities right now. To start, we've had an additional 274 people diagnosed with COVID-19 in British Columbia, including one epidemiologically linked case, bringing our total number of people with COVID-19 to 12,331 in British Columbia. That includes 4,260 people in Vancouver Coastal Health, 6,720 sorry, I can't even read my writing, in Fraser Health, 249 people in Vancouver Island, 644 people in Interior Health, 365 people in Northern Health, and 88 people who generally reside outside of Canada. We have 1,920 active cases right now, of whom 71 are hospitalized, 24 of whom are in critical care or ICU. We thankfully have no new deaths to report today, but we do have 4,425 people under active public health monitoring and 10,114 people who are considered recovered. I do want to take a moment, however, to recognize the data was released yesterday from the coroner around the number of people in British Columbia who have died from overdoses. We had additional 127 people from our communities across British Columbia who died in the month of September. And my condolences and my thoughts and prayers are with their families and their communities, as we all know the incredible toll that both the pandemic and our overdose crisis have taken on our communities and on people who use drugs in this province. We have no new healthcare outbreaks to report at this time, and one of the outbreaks that we had at the Weinberg residence has now been declared over. That leaves us with 19 active outbreaks in our healthcare system, 17 in long-term care or assisted living, and 2 in acute care. Involving 950 residents, people, 546 residents, and 404 staff. There have been no new community outbreaks. However, yesterday we had our first school outbreak announced, and that is one of the issues that I want to talk to a little bit today. The identification of this outbreak came because of the work that we're doing with schools across the province to monitor and to contact trace anybody who has been exposed in our school system. And while it is obviously not what any of us want to see, it is not unexpected, as we know that COVID-19 is still circulating in our communities, and we know that that is reflected in what is happening in our school communities as well. Public health teams in Interior Health identified that there was unlinked transmission. Initially, there were 3 cases identified, and as of today, as the investigation continues, we're up to 5 cases that are related in the school community. And steps were taken by public health, working with the school, to ensure that they can contain the spread to the involved cohorts. And right now, that means 160 people in the school community are at home self-isolating, and the school is working with the families to make sure that ongoing educational needs can be met. And public health teams continue to be on-site working with the school community to continue the investigation and make sure that we have a full picture of who has potentially been exposed and who may develop symptoms in the coming weeks. And just a reminder that we are working very closely with the school community, and if you have not been contacted by public health to self-isolate, that you can continue to monitor yourself and go to school as you normally would. I do want to give a little bit of perspective. As you know, we've been reporting on all exposure events in schools since they returned to in-classroom learning on September 8th. And of the over 600,000 children and 35,000 teachers and staff involved, we have had a number of exposure events. We're now up to 213 in the somewhat 2,000, over 2,000 schools that we have. We've had 6 clusters, or where more than one person in the school has been identified, has been exposed within that school. And this is our first outbreak. So I think that helps us put it in the perspective that we are not seeing return to school causing amplification in our communities, but it does, as we've been expecting, reflect what is going on in our communities. The majority of the exposure events that we have had in schools that have not led to transmission to anyone else in that school community, and the majority of them have been in the Fraser Health and Vancouver Coastal Health regions, where of course we have the largest population of school children and the largest numbers of schools. So while it's concerning that we have an outbreak, what I think is positive about this is that we have been monitoring all of the exposure events, and we have had very little transmission in the schools, and public health has been working with the school community across the province to keep it that way. The other thing that is more concerning to us now is that social gatherings are where we are seeing significant transmission of COVID-19 in our province, and the impact is far-reaching. While contact tracing teams are working hard to contain the spread, we have seen that new cases stemming from social gatherings are spilling over to other locations, to other parts of our community. Social gatherings, especially recently, weddings and other celebrations, are proving to be high risk for all of us. Much of the recent surge that we have seen in cases in BC in the last couple of weeks is directly linked to social events. These events have caused clusters and outbreaks that have now spilled over into our healthcare system. So people who may have been at an event or a healthcare worker working at a long-term care facility, and workplaces. We have seen now several large workplace clusters as well, and in our schools. And while many of these cases are concentrated in the Lower Mainland, the cases connected to events have spread right across this province. People who have come to an event that might be in the Lower Mainland have returned home. And the contact tracing, we have seen that people are not sticking with their COVID-19 safety plans for social gatherings, particularly ones like weddings and funerals. And that is a challenge that we all have right now. We may have the best intentions to keep them small, to make sure that we aren't having buffets, that there's individual servings, that people are keeping their physical and social distance. But it is hard, and right now it is not working for many reasons. We all, as social creatures, need to come together. We want to be with the people we love for these celebrations, and it is very hard to keep to those important limits that help prevent transmission of this virus. People are also coming together, and some cases traveling from other parts of the province or from other provinces, and they bring those risks with them. And when they leave, others are taking those risks home with them. And we have seen this now spill over into other parts of our communities. We saw this same phenomenon occur with house parties and vacation rentals this summer, particularly in the interior. And now we're seeing it with these family celebrations at people's homes and elsewhere. And I do want to say, that for the most part, people in our province have done the right thing and are continuing to do the right thing. They've listened, we followed public health restrictions, and I want to thank people for that, because we know that it is incredibly important, and it is the reason that we have been able to open up as much as we have and keep our economy and our communities functioning. However, as much as I am hesitant to do so, and we've seen this before, if there is a major source of transmission, additional measures can and will be put in place if they're needed. We will use all the tools that are available, whether that is conditions tied to wedding licenses, restrictions on numbers in indoor gatherings, or other measures that we know will be effective in trying to break these large transmission events. The reality is that right now in BC, everywhere in BC, weddings, funerals, and other life occasions need to be small as possible. Every gathering needs to be our own household only, and at maximum, our safe 6. We need to put in place those same thinking that we did in the summer when we saw surges in vacation rentals and parties that were happening to all of our social gatherings. This is a critical time as we're heading into our influenza season, as we are focusing on the priorities in our communities of keeping our businesses, our schools open for the health and well-being of all of our communities. Now is a time where we need to control and manage our social gatherings to keep this virus in check and prevent it from spreading to those in our family and our community who are going to be most affected by it. This may mean a civil ceremony now for people who are looking at getting married with a very small number of people, and save that important celebration and party to next year when it is safe for us to do that with those family and loved ones that we care about. As hosts of the celebrations, I ask you not to invite others to your gathering right now, and not take offense if people choose not to come because they are concerned about their own safety or about the risk that they may be bringing with them. Show you care by keeping those outside your immediate household off your invite list right now. Sometimes it's very challenging for people to say no because we want to be supportive, we want to be together with our families. But it is not safe for everybody right now, and we need to recognize that and accept that in the people in our lives, in our communities. As a guest, support your loved ones by choosing not to attend and by showing your support in other ways. The risk is too high for all of us, and we have seen that in other jurisdictions, both here in Canada, in the United States, and around the world, that this virus can get out of control very quickly, but we can do our part to have those safe celebrations in a small way and save those larger celebrations and memorials for a time when it is safe. You may think the risk also doesn't apply to you because you live far away from the Lower Mainland, or you are very healthy right now and you don't have those same concerns. But we have seen on many occasions, and again we have seen this week, that COVID-19 knows no boundaries and impacts us all. This virus affects people, and when people move, we take our risk with us. And we have seen that spread to all parts of this province, and we've seen it spread from other provinces here, and we take that home with us. We've also seen spread in businesses, and we know that people have done a lot of work to make sure it is safe for restaurants, for office, for retail outlets, for any type of business to have their COVID safety plan. But now is the time to revisit the workplace safety plans that you have put in place. We have seen transmission in lunchrooms, in carpools, with workplace social interactions, and in the workplace itself. There will be an increased inspections by WorkSafe BC in the coming weeks and days, and by our environmental health teams, and enhanced enforcement across the province to try and address some of these issues so that we can maintain and continue to break those chains of transmission. So make sure you and your employees are doing what we need to keep everybody safe. We all have a role to play, and we know that here in BC, and we have done our part. We need to continue on this road together, and we all need to continue to take those measures which protect those who are closest to us, and to protect our communities, and to protect those we don't know. What you do impacts everyone around you, and what you do makes a difference. So I am appealing to us all. We need to continue to do our part together, to stand together by staying apart, and we need to do that every day. And please we need to do this as well by being kind to each other, remaining calm, even though we may have concerns about what is happening around this virus and around our communities, because that is how we will continue to keep each other safe. Thank you, and I'm happy to take questions.
Thank you, Dr. Henry. As a reminder to everybody on the phone, please press star 1 to enter the queue. You are limited to one question and one follow-up only. I would also ask that you please take your phones off mute. You will not be audible until your name is called. First question today is from Richard Zisman, Global News.
Dr. Henry, we now have back-to-back days of record-breaking cases, and on Saturday, British Columbians go to the polls. Do you think that this surge in cases that we have seen will have an impact on the result in terms of who people vote for in this election?
I actually really couldn't say anything about that. I know that many people have been voting by mail, and there's been record numbers at advance polls, so I think I'll leave the speculation part out of it. I know that we have seen surges in communities around the world in the last few weeks, and we are no exception. But people in BC continue to do the things that do our best to keep things safe. And I've identified 2 areas today where we need to step up and take some more action. And we've talked about this before, the importance of these relatively small sacrifices in the grand scheme of things. And I know if you're somebody who's been planning a wedding for the coming weeks and you expect to have 49 people there, now's the time to rethink that. It may not be safe for everybody that you want at your special day. And you need to rethink about how to make sure you can maintain safe distances and that you can protect those who may be not able as well to say no to being part of your celebration.
Do you have a follow-up, Richard?
I do. You've clearly worked very closely with John Horgan and with Adrian Dix. Again, I don't want to put you in the position to have to make a political judgment here, but can you explain to British Columbians whether there should be any blame placed on politicians for what we're seeing in COVID-19, or whether voters should be thinking about politicians as a success story when it comes to COVID-19?
Yeah, I think one of the important things about the role that public health plays and the role of my office is that we have an independent role to protect the health of the public and to speak to the public about health issues. And we've done that from the very beginning. We've continued to do that, as you can see, through this whole interregnum election period. And I will say as well that we have, myself and the Deputy of Health, we've had regular ongoing relationships and discussions with all parties about this crisis, because this crisis is above the political issues. It is about doing the right things and the best things that we can do to protect the people of British Columbia, and we'll continue to do that.
Next question is from Zara Premji, CBC.
Hi there, Dr. Henry. So a strong warning from you today about cases of the virus still being transmitted at events like weddings and funerals. So can you please give us more specific details about the events recently linked to COVID-19 spread and how many people are typically getting together?
Well, I can give you some general details, but yes, what we're seeing is that there may be an event that is planned to have 40 or 35 people, but on the day of the event, somebody brings somebody, other people are coming, maybe it's hard to limit the numbers of people who are there, and as the evening progresses or the celebration progresses, we're seeing much more mixing and interacting of people, where we know that that is a way that this virus can transmit. The things that we have learned are this virus transmits easily when you're in close contact with people, particularly if you're doing things like hugging and dancing and singing and eating and drinking together. And those are the situations that we're seeing with weddings in particular. In the last couple of weeks, we've had a number of them where there have been multiple events with different groups of people. So while The intent may have been to have small distance groups and numbers under 50. Sometimes that doesn't happen, or people change their plans as the evening progresses, and that has led to inadvertent transmission and unfortunately to sometimes larger groups of people. And it can make it challenging as well to find people. So there may be a wedding that has several different parts to it, where everybody is doing the right thing in one area, whether it's an office or a church or some other place where everybody's nicely spaced off, but then they go back to the house and everybody mixes and mingles together and shares food, as we do with people that we love and we care about and that we may not have seen for some time. So those are events that we're seeing continue to happen, and it's been challenging. We hear from event organizers that they're sometimes feeling put on the spot, that they can't control the numbers of people who end up at the event. So it's happening in households, it's happening in sometimes in hotels and in other spaces. And we're also seeing that people are having one event with a smaller number and then another event with a different group of people. And that, again, introduces more risk. So we've seen things as well around party buses again, and limousines where there's been large numbers of people together in close contact without wearing masks and with having communication and contact with people who are outside of their usual small social circle. And I know we all want to do this. We know how important these life-changing events are for all of us and to have those celebrations. But right now, with the global pandemic, with cases surging all around us, with the numbers that we're seeing, we know it's in our community now. And for us to live with it through this respiratory season, through this winter, we need to take those measures now to keep those important celebrations small and plan for when we can have those larger celebrations in a safe way next year.
Sarah, do you have a follow-up?
Yes, please. I know you mentioned this a bit earlier, but is it time to reconsider this 50-person limit at gatherings in our province and make the maximum number of people allowed much smaller than that? And when could the stronger reinforcement and measures be put in place?
Yeah, we are considering all the options, and certainly changing of orders is one of them. As I've done all along, we've tried to be consistent, but we recognize that as we're moving into the winter, even with our winters in BC, we move inside more, and that increases our risk. So we need to take those measures that recognize that inside it's very challenging in many houses, many apartments, certainly my house, to have more than 2 or 3 or 4 other people. And if we live in a large family with a home with multi-generational people in the home, we need to think about those other activities that we do, whether that means not going to a spin class, because that may be a riskier environment if I'm living with a multi-generational family with my grandparents and others who might be at risk. So these are all things that we need to think about now to help us keep things going in our communities and keep our communities healthy over the coming months. And I will say this is not forever. And I know I've been saying that for months, but it is true. We are going to come through this pandemic. And our pandemic in BC is slightly different than everybody else's. We are going to come through this, but we still need to maintain those measures that are going to protect our communities now. And it's going to be months that we need to support each other in doing this.
Next question is from Marcella Bernardo, News 1130.
Hi, Dr. Henry. Thanks for taking my question. This is going to elaborate a bit on what Zara was asking you about, but I'm getting lots of concerns from people about the confusion regarding stick to 6. If you're telling people that we need to stick to 6, but they're still spending time with people in their backyards that are up to 20 to 30 people, is there a way to get that message across that doesn't seem to be getting through? Because we're hearing from people who are saying, I was confused about how many people I'm allowed to spend time with. So how do we get that message across? That if you are gathering with people, more than 6 people, that you are putting yourself and others at risk?
Yeah, well, I think you said it. This is our challenge right now, is to be able to have our social interactions and support each other, but do it in a way that is safe. And if you have most backyards in this province, having 20 or 30 people in the backyard is not safe. And it's even less safe if you have those people inside in your house. So yes, we now need to take a step back, and we've talked about this a little in August as we were moving into schools reopening, that it's a time to reset, and to make sure that we're keeping our groups small and that we're keeping our spaces, because we know that it's important to go to work. We know that it's important to go to school. We know it's important to participate in some of those sports or arts activities for children. So that means that we have to pull back on the social side of our lives. And, 6 may be too many for some larger families. It may be just right for others. So everybody needs to make their own judgment about this, but 6 is a maximum, let's just say, for those social interactions.
Marcella, do you have a follow-up?
I do, just regarding we asked Dr. Lee about this in Fraser Health today, but there seems to be more clusters linked to community sports and recreational facilities, much like you did in the spring with gyms and fitness centers. Are one of the restrictions that you're looking at imposing now going to be to crack down on hockey rinks and places where too many people are on the ice or too many people are gathering to play sports?
Yeah, so I talked about this a little bit last week, but I do think it's important for us to focus on the players. Particularly on young people who are playing on teams. And that may mean that not all parents are in the hockey rink or on the sides of the football field. I think it's really important to stick to small numbers. And yes, it's a good growth opportunity for many children too. So let's look at it that way, and let's look at how we can keep the sidelines and the spectators free so that it's safe for the players. And we also talked about limiting so that you're not exposing yourself to multiple groups of people. So if I'm playing hockey, old timers hockey, then I do it with one group of people, not my regular 2 or 3 hockey teams that I might play on. Those are important considerations for this year, for this getting us through this pandemic. And you're right, we've seen transmission in spectators who are watching games, and that is the part that we need to say, okay, to focus on the players, like the NHL did. Focus on our player bubbles and make sure we're not putting people at risk.
Next question is from Nick Johansson, Castanet.
Hi, Dr. Henry. With regards to the outbreak here in Kelowna at the Kelowna school, could you elaborate these 5 cases? Are these students or staff?
It's a mixture of students and staff, so it is both, and it's in cohorts that were mixing together, but also there's been, like everything, some of it is on looking at exposures that may have been on school buses and other settings as well. If we look overall, and I am being quite cautious because we know that if we give specific numbers when there's such small numbers like this in a small community, people can be identified. But if we look overall for the 216 exposure events we've had, they reflect that about a third of them are in staff and about a third are in students. Or sorry, 2/3 are in students, and that reflects the numbers of children versus staff as well.
Do you have a follow-up, Nick?
Yes, thank you. With this Kelowna outbreak, are you able to provide a timeline of when the first case was identified at the school and when it was discovered that transmission had actually occurred within the school?
I actually don't have the details of when the first exposure was. I know Interior Health has been providing more details around that, but it certainly came to light within on the weekend, last weekend, and then the investigation started on Sunday this week.
Lisa Cordasco, CHLY.
Thank you. Thank you for taking my question, Dr. Henry. Can you say what percentage of the new cases this week are related to Thanksgiving gatherings?
Yeah, we've had, so this is one of the things that the contact tracing work is to try and understand where people might have been exposed. And I know of at least one or two that were related to Thanksgiving gatherings, family gatherings that were quite large, not over the 50 limit, but groups of families coming together. So a small percentage, but that certainly was part of what we're seeing in the past week.
Do you have a follow-up, Lisa?
Yes, thank you. In the Island Health Region, our health officer has said that some people working, on the COVID file, previouses, are being deployed for immunization clinics. Given the new numbers, is this a matter of concern for you, taking people away from tracing COVID cases or whatnot to be doing immunization clinics?
No, I think that these things are things that we need to balance, and we've been balancing the need. I know some of the people from Vancouver Island have been redeployed to Fraser to support the work there, and we're looking at how we can do that. Particularly, I've been working with my public health teams around the province to make sure we can support each other as we get surges. And certainly in the summer, we supported interior health. The north needed some, and right now, of course, our focus is where most of the cases are in Fraser Health. So all of us are committed to not only maintaining the case and contact management, which is part of our important control strategies for the pandemic. So we need to deploy people where needed, but also to make sure that we can provide immunization, particularly for influenza right now, because that as well is an important measure to reduce respiratory illness and help us weather this next few months here in the province.
Next question is from Phil McLaughlin, Kelowna Capital News.
Hi, Dr. Henry. Thanks very much for taking my question. With regards to the outbreak at the Kelowna Francophone School, which has caused 160 people to self-isolate, at what point do you think the government would or should step in to close a school like this until further notice?
Yeah, so the medical health officers, the school health officer in Kelowna is leading on this with the school, with the principal, making sure that we know and are doing the detailed investigation that we do for all of these outbreaks. And right now, they're confident that they've addressed people who have been exposed. But that is, it is a possibility. If the investigation shows that there have been other exposures that come to light in the course of the investigation, then that might be an option. It may be another cohort may need to also be monitored or isolate, or it may need to close the school. I think that's unlikely given what I understand about this outbreak and the investigation so far. One of the things that we talked about early on when I was asked, what would close the school, would be if there was large numbers of the staff who needed to be in isolation because they had been exposed and they wasn't able to operate the school safely. That's not the case right now in Kelowna, but obviously these things evolve over the days as the investigation goes.
Phil, do you have a follow-up?
I do. Thank you very much. Going forward, do you think the outbreak at this school will bring with it changes to guidelines or protocols within other schools in BC?
Well, we learn from every exposure event, we learn from every cluster, and we learn from every outbreak. And we've seen this from our long-term care, how we approach outbreaks in long-term care. We learned a lot very early on. So this is our first school outbreak, and we will learn from it. And if there are things that come to light that will help reduce potential for this happening in other schools, then absolutely we will be looking at how we can expand those measures to every school.
Next question is from Mike Hager, Globe and Mail.
Hi, Dr. Henry, and thanks for taking our questions. Wanted to know, nearing the end of the election campaign, what your assessment is from a public health perspective of how things have gone. Have there been any transmissions linked to election-related activities?
Yeah, so I voted myself in one of the advanced polls last week, and I was very impressed by the way it has been playing out. It went very smoothly. People were biding their time, wearing masks. The way it was set up met all the criteria that we needed. So I think Elections BC has done an excellent job, and I know that there's been a lot of people who have taken advantage of the mail-in ballots. I've not heard of any concerns about people being ill or any transmission or any even exposure events, and we've been keeping in close contact with Elections BC through the last couple of weeks, and as far as we can tell, things are going really well.
Do you have a follow-up, Mike?
Yes. So were you in contact with the individual parties about their campaigning tactics and plans, or were you talking specifically with Elections BC, who then filtered that message out? And were any specific activities on the campaign trail nixed by your office for being too risky? And if so, which were those?
Yeah, so yes, we were in contact with, there's a multi-party committee from the political parties. It's I think it was called the BC Elections Committee or something like that. That is, that Elections BC supports. And so we met with them on a number of occasions to walk through what things should and shouldn't be done. And each party developed a plan, a COVID safety plan, as we have for all of our events here in BC. And so we did review those and provided advice on things that we thought would be helpful in terms of what can and can't be done, and how to physically distance, and wearing of masks, and advice about how to approach campaigning for this as we do for every other sector. So yes, we did have those discussions early on and prior to the election being called.
Next question is from Claudia Van Emmerich, Global Okanagan. Claudia, are you on mute? Okay, we're going to move on. Brishti Basu, Victoria Buzz.
Henry, thanks for taking my question. There was a surge in cases over the summer that was linked to people partying, and at that point there was a lot of emphasis on the age group, focusing on the fact that they were all young people in their 20s and 30s. My question is it the same age group that we're seeing the most transmission happening in now, or has that shifted at all?
It has shifted. We've seen a slight decrease particularly in the 20s to 30s age group, as things like university and schools and workplaces have gone back, and a slight increase in the 30s and 40s and 50s. Though having said that, in the last week we've seen a slight uptick in all age groups, but it's not been disproportionately in the younger age group as it was in the summer, so it has shifted a little bit. Still, though, the majority of cases are in younger adults, mostly healthy younger adults. And we still see children, although we're testing children more since school has gone back. Children are still underrepresented, so they're about half of the population. So, for example, children under the age of 10 make up about 10% of our population and about 5% of the cases that we've seen in BC, even though the testing has gone up. So where we're seeing the most cases is in adults between the ages of 20 and 50.
Do you have a follow-up, Brishti?
Triggers. We do have a new, more detailed situation report that's coming out from the BC CDC every week. It'll be a weekly report, putting in context some of that really important information. So there is a table on there and a diagram that will show the age groups that have been affected, and particularly in the last week. And it'll be up on the BC CDC website around 5 o'clock today, and then every Thursday from now on. So lots of good information and details in there that help put this in a weekly perspective. I mean, we talk about the numbers every day, but it really is looking at trends over the week or longer that helps us understand where we're going with this pandemic.
Do you have a follow-up, Brishti? Okay. Kat Slepian, Black Press.
Hi, Dr. Henry. You mentioned that there would be an increase in workplace inspections from work safety feet. And I'm curious, what kind of violations are you guys seeing for concerning things in workplaces that are leading to you guys taking this measure?
Yeah, so it's not necessarily violations so much. It's, we have these COVID safety plans that everybody has, and where we're seeing now is there's transmissions happening between workers, for the most part, in break rooms where they're not maintaining distance or people are all gathering together and having lunch together, carpooling, and sometimes on the workplace itself. So we had, as you know, a meat processing plant where we had transmission to quite a lot of employees. So it's reinforcing the importance of the distancing measures, the barriers, all of the different measures that need to be in place in that type of a work environment. So there has been a whole variety of work environments that have had transmission events. Most of them have been related to social functions, for example. So we need to reinforce, and I'm calling on all of those businesses out there to reinforce the things that keep each of their staff people safe and in turn customers safe as well.
Kat, do you have a follow-up?
Yeah. So in the spring, we saw a lot of businesses send their employees home to, I guess, work from home. Since then, we've seen a lot of workers return to the office. Is it time for workplaces to consider work from home again, especially kind of as flu season hits?
Yeah, so again, with the COVID safety plans, and we saw this with the public service in the past couple of weeks, it's, our advice is to make sure that if people are returning to the office situation, that they have the ability to maintain those distances between desks or cubes or workspaces, and that you don't have everybody coming together for meetings as we did before, so that we have those safety plans in place. And that can mean, and I know in the Ministry of Health, it means that people are coming in 1 or 2 days a week, not 5 days a week, and that we're staggering so that there are ability for people to work effectively from home, to not have to gather in large numbers, and to make accommodations for people who may be more at risk and are able to work safely from home.
Rob Monroe, Info News.
Oh, thank you. Dr. Henry, your opening comments about the outbreak in Kelowna at the school, I think I heard you say that they were unlinked transmissions. So does that mean these are people that got COVID from outside the schools and brought them in, or that it has spread within the school?
Yeah, so it is spread within the school. The index case, somebody brought it in after being exposed outside of the school environment. And when we do the detailed asking of each person and trying to figure out who had contact with who, we recognized there were some people who were ill, and when they were tested, they were positive. And so now's the time that they're trying to piece together how they might have become infected in the school environment. So yes, it means that there was transmission happening in the school environment that we're not quite sure how yet. And that's where the outbreak investigation is really important and helps us piece that together. So it's like putting together the pieces of the puzzle. But as soon as we recognize that there were cases that we're not quite sure how they got them, that's when the outbreak was declared and people were sent home for self-isolation, and so the investigation could be done while making sure there was no further transmission happening.
Rob, do you have a follow-up?
But it came from one person that spread it to the other 4 so far, and do we know this is a French school? Would this have come from, say, someone coming up from Quebec?
There's no link to Quebec that I'm aware of, but there certainly is links to travelers from other parts of the province who may have been the source of the original case. And this is what we're still trying to piece together, who passed it to whom when. And that's part of the challenge of this. And that will become clearer as the outbreak investigation continues.
We have time for one more question this afternoon. For everyone listening today, Dr. Henry will release a statement later on with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For medical guidance on protecting families and communities, and for access to provincial guidance on COVID-19, visit bccdc.ca. And for information about the province's pandemic supports, visit gov.bc.ca/COVID-19. Last question is from Jane Side, North Shore News.
Hi, Dr. Henry. My question also concerns the school outbreak. I'm just hoping that you can explain the difference between what happened at the Kelowna school that was just declared an outbreak and, say, what happened at West Vancouver's Caulfield School, where there were also a number of students in different cohorts, at least two of them, who did have COVID and then passed it on to family members. Is it a case of you knowing how that was transmitted versus not, or what's the difference between those two cases?
Yeah, so I won't talk about specifics around Caulfield, but what we look at is where somebody was likely to have acquired the virus. And so in the case in the interior, when additional cases became apparent, so initially we knew of 3 people, and it looked like there was transmission that happened within the school. In a case where we call it a cluster, we often know that there's a person who's positive, but they may not have been in the school during their infectious period. They may have transmitted it to other school children or teachers may have transmitted it to staff members or vice versa, but it wasn't happening in the school setting. And so that's the difference between where somebody was exposed to the virus and what we have in Kelowna, where there's been transmission within the school setting that needs to be investigated and managed and controlled.
Jane, do you have a follow-up?
Yeah, I have a follow-up, which is also related to schools and the temporary transition program that a number of families have chosen for their children. They've been told that the program basically ends at Christmas and they have to make a decision then. A number of families have indicated that they're wanting to continue with the at-home online option, but I guess that's in the hands of the provincial ministry. I'm wondering whether you would have any advice to the Ministry of Education or any thoughts on people being able to continue that type of program.
Yeah, as you say, those are educational decisions that are made by the Ministry of Education in conjunction with the school districts and the schools. And my advice is around health impacts and the health measures that we need to have in place to prevent transmission of all infections, including COVID, in the schools.
That's all the time we...
Thank you very much.
Good. Thank you. Thanks for joining us.